So on whiteboard we have understood about the PR interval and the physiology through the AV node. Okay, now we are going to understand the real-time ECG for the PR interval. So today's topic is PR interval. So first understand what is the PR interval with this ECG paper. So this is real-time ECG paper and you can see here the P wave, QRS wave and T wave, P wave, QRS wave and T wave. Fine. So what is PR interval? PR interval is the interval starting from the P wave to the starting of the R wave. Okay, so this is the starting of the P wave to the starting of R wave. If you see the ECG paper here, you can see 1, 2, 3 and 4 small squares are covered. So what does that mean? Let's understand this with the little zoomed version. Then one large box is shown here and one large box will have 1, 2, 3, 4 and 5 small square. Now one large box represents 0.2 seconds. So one small box represents 0.04 seconds. So in our example we have seen P to R interval, that is starting of the P to the starting of the R is 4 small square equal to 0.16 seconds. Now what is the normal PR interval? Whether this is normal or not, let's see what is normal PR interval. So normal PR interval is 0.12 to 0.20 seconds. That means 3 to 5 small square. If PR interval is less than 3, it's a short PR interval. More than 5 small square, it is a prolonged PR interval. So now let's understand with this ECG. This is the ECG given. The question is what is the PR interval in the ECG. Let's focus here on the complex. This is the P wave and this is the QRS. This is starting of the R, starting of the P. So starting of the P, if we start 1, 2, 3 and 4. 4 small square. Okay. So 4 small square, what you get is the 0.16 second. That is a normal PR interval because it's between 0.12 to 0.20 second and it's between 3 to 5 small square. So this is a normal PR interval. Now let's understand about the AV block. Now AV blocks are in the 3 degrees, first degree, second degree and third degree. We'll understand each block with the example. Now first degree AV block is defined by PR interval which is more than 0.20 second, or in other words to tell more than 5 small square. And the more important criteria, every P must be followed by the QRS constantly. Fine. So let's understand with the ECG paper here. This is the P wave and this is the QRS. So starting of the R wave. Starting of the P to starting of the R, if you see the distance, 1 large square equal to 5 small square plus 1, 2 and 3. So total 8 small square equal to 0.32 second. That is prolonged PR. Okay. Next complex, same thing. P to R is 0.32 second. Next complex, same thing. Now the second criteria, if you check, every P is followed by QRS. This is P, this is QRS. This is P, this is QRS. This is P, this is QRS. So both the criteria are fulfilled and this is first degree AV block. Now let's understand with the real time ECG. So the question is what is PR interval? If you see this ECG, this is the complex highlighted and here is the P wave starting, here is the R wave starting. The distance from this to this is 1, 2, 3, 4, 5, 6, 7 and 8. 8 small square means 0.32 second, which is more than 0.20 second, and the small squares are more than 5 small square. Okay, now let's see the every P is followed by QRS or not. This is P wave, this is QRS, this is P wave, this is QRS, P wave, QRS, P, QRS. So every P is followed by the QRS and PR is prolonged. So now we have the two criteria here. PR is more than 0.20 second or more than 5 small square with every P followed by QRS. So your diagnosis will be the first degree AV block. Now second degree AV blocks are two types, Mobitz type 1 and Mobitz type 2. Mobitz type 1, here we'll understand. The Mobitz type 1 is characterized by the gradually prolonging PR interval followed by a dropping bit. Okay, it means the PR interval first will be prolonged, then the next bit it will further prolong, then it might prolong further, and after that a bit will drop. Fine. So let's understand this thing with the example. This is the given ECG. This is P wave, this is QRS complex. Starting of the P, starting of the R. So PR interval, if you see here, 5 plus 3 small square, so 0.32 second. So P and QRS and PR is prolonged. Then next wave P and QRS, starting of the P and starting of the R. If you see the PR interval, 1, 2, 2 large square means 10 small square and again 3 more small squares. So total it will become 14 small square. So total what you will get is 0.50, 13 small square. So you get the 0.52 second, which is more than 0.32 second. So PR is gradually getting prolonged. Now next bit, if you see, there is a P wave but QRS is dropped. Correct. So when PR is gradually prolonging and after that one P wave the QRS drops, it tells there is a second degree AV block, Mobitz type 1. You can see the sequence again, P to R prolong, further prolonging P to R, and then P wave and drop bit. So that is the example of the second degree AV block Mobitz type 1. Now let's understand the real time ECG with one example. This is the given ECG. This is the P wave, then there is a QRS complex. If you consider interval from the P to onset of the R wave, it is 1 large square plus 4 small square. So 9 small square is the interval. So around 0.36 second will be the PR interval. Next, if you see, this is the P wave and this is the R wave. So there are two large square plus 1. Okay, so 11. So 0.44 second will be the PR interval. So here it was 0.36, here it's a 0.44. It's a gradually prolonging. Now here if you see P wave, it's there, but the QRS complex is missing or it's a dropped. Okay, so gradually prolonging PR interval followed by a dropped QRS is characteristic of the type 2 second degree heart block Mobitz type 1. Okay, now cycle repeat same, PR interval prolong, PR interval further prolong, P wave, and then there is no QRS. Fine. So here you can see gradually prolonging PR interval followed by a drop bit, and the diagnosis will be the second degree AV block Mobitz type 1. Fine. So now let's go for the second degree AV block Mobitz type 2. Now what is the main difference? In Mobitz type 2, the PR interval will be constant, and after few bits of the P, the QRS will drop. Okay, the constant PR interval and the drop bit, it's Mobitz type 2 block. Okay, so let's understand with the example. This is the P and this is the QRS. The distance P to R is 0.32 second, 8 small square you can see here. Next wave same, P to R, constant PR interval, here 0.32 second, here also same 0.32 second or 8 small square. If you see here P, the QRS is dropped afterwards. So constant PR interval and dropped QRS means it's a second degree AV block Mobitz type 2. You can see here also P, QRS, the interval 0.32. P, QRS 0.32 and P and followed by drop bit. So this is the rhythm strip for the second degree AV block Mobitz type 2, which has constant PR interval followed by a drop bit. Now we understand the second degree blocks. Now we go for the third degree AV block, that is also called the complete heart block. When the complete heart block is there will be the complete absence of the AV conduction. So whenever the AV conduction doesn't happen, atria beats by the pacemaker at the SA node and ventricle beats independently by the pacemaker below the AV node. So you have two independent pacemaker which are beating and they are not related to each other. Okay, so how it comes on the ECG? The atria beating P waves and ventricle beating QRS wave will be regular and at the rate, but there won't be any constant relationship between the P and QRS. Let's understand this with the example. So this is the given ECG. You can see here the P wave is there, then the QRS. Now here the P wave, here this is T wave. Now here again the P wave, then the QRS. Now here the distance is this much, here it's little prolonged, here the P wave and here the QRS, again the P wave. So P and QRS are not much related. The next thing, if you see each P wave, this 1, 2, 3 and 4, the distance between P wave to P wave, here, then here, then here, it's a constant. So P is beating at the constant rate. Now let's see about the QRS. This is the one QRS, second QRS and third QRS. So here from QRS to QRS distance, here from QRS to QRS distance, that is also constant. So P distance is constant, that tells the atria is beating regularly. QRS is constant, that tells ventricular is beating regularly. No correlationship between the P and QRS, that tells it's a complete AV block. Fine. So this is the example of the complete AV block. Let's understand the real time ECG. Now in the given ECG, just focus on the rhythm strip. Okay, so this is the rhythm strip. Okay, now first what we'll understand, where are the P waves? So this is the P wave, you can see here. Next P wave here, then here, then here P, then the P wave here, then the P wave here and P wave here. Fine. Now if you see the distance between each P wave, it's a 1, 2 and 3 large square. Okay, 1, 2 and 3, 1, 2 and 3. So P waves are coming constantly at the distance of the 3 large square. So rate is around 100 bit per minute for P wave. Now let's focus on the QRS. This is QRS complex, this is QRS complex, this is QRS complex and this is QRS complex. You see the distance between each QRS is again the constant. But if you see, this is the P QRS here, P QRS here, P QRS here. So P and QRS are not related to each other, and P is constant interval, QRS is constant interval, that tells it's a complete heart block. Correct? So this is example of the ECG with the complete third degree AV block. If you are learning something from our videos, subscribe to our channel and like our videos. You can suggest something in the comment. We'll try to improve further. Thank you.